There's so much for new parents to learn about caring for their baby, and you may be wondering where you can get help.
Look for a home visitors program at the nearby family service agency. Here, you'll find loving support from expert caregivers who will share tips and suggestions to care for your baby and who understand what you're going through and offer so many ways to help.
I'm Loretta Barif, and I am the director for Family Focus Inglewood.
I'm Simone Smith. I'm a home visitor at Family Focus.
Hi, I'm Artrice Hill, and I am a home visitor at Family Focus Inglewood.
Why do you think it's important for a mom to enter a home visiting program early, even before the birth of the baby?
It's important to start the bonding process as early as possible. So it's important to start home visiting prenatally so that mom can interact with the baby in utero so that when the baby is born, they have a stronger bond and a stronger attachment. And it also speaks to preventing rather than an intervention service. So if we can prevent, violence or traumatic experiences, it's better than having to intervene later.
When a mom gets home visiting services, she is able to get a lot of information and knowledge that helps build her confidence in parenting early, and she's able to find out about more resources and things to help sustain her and support her, so she's has more confidence long term in parenting.
Let's talk a little bit more about prenatal care and the work you do as a home visitor.
I think prenatally, home visiting services are essential because, in particular, we offer doula services, and it's great to be able to advocate for the women, especially when you have them going to doctor's appointments or even in the labor and delivery room, and you hear a lot of jargon, medical terms that they may not understand. So you have doulas there to advocate for them.
What other resources, the family receive as a result of having a home visitor coming into their homes?
Well, on top of just having an extra support system for the family, we also offer support groups. We have parenting groups and prenatal groups. And in the groups, they get a lot of information. They build relationships with other mothers and families who are in the same, situations as they are. We also offer, groups for the fathers to try and keep the fathers more involved in the lives of the children and the mothers. We try and connect them with different resources within the community. We've, offered job information or housing information as we get it. So I think there are a lot of things that the home visiting programs can offer to moms and families.
And Ms. Artrice, maybe you can speak even a bit more about the benchmarks and how the work that you do in the home affects or changes maybe the lives of families.
With the program for home visiting, we assist the moms in helping them to find a medical home that they can have for themselves and their baby, where they can have regular medical services that they would like to receive for prenatal care and well child visits. We also assist them in birth control education so that they can plan their next pregnancy and know what they would like to do and how long they would like to wait before having their next child. They also receive information about schools, different jobs or programs within the communities where they can engage in job education or whatever type of goals they would like to work on. We make sure that they have just a vast array of resources so that they can maybe make some goals for themselves and work towards their goals for stability. We try to assist them throughout their child's life until the age between 3 and 5 years of age.
A home visitor can come in just as an unbiased ear. You have the pressures of being a mother, but you're still a child at the same time.
expand a bit more on some of the tips and some of the tools of your trades that you bring into the home as you home visit families in the community.
Well, we try to encourage the moms to understand that that they're gaining knowledge, they're a parent, and they have a lot of information that's available to them, and we teach them different things that they could use, and that they can try different things in terms of parenting. That they should ask a lot of questions to the doctor about different things that they see as concerns, and we just teach them to just be open to learning about their child's needs or whatever it is that they have concerns about.
Well, as we know, there's no manual for parenting, but we do encourage development with the child and focusing on the positive development of the child. We do come into the home with ages and stages questionnaires, which monitors the development monthly with the child. And so we like to point out even the smallest tips of development. So if we have a 3-month-old and they're now opening their hands, we want to make sure that mom notices that and gets excited about it. We have parenting groups that educate the families on health and nutrition, when the child should visit the doctor, when they can expect to see teeth coming in, some of the healthier options for feeding the baby.
During the groups, they do learn additional information about the differences in bottle feeding versus breastfeeding. They learn the benefits in the long term, and how the baby is able to gain more nutrients from breastfeeding. They also learn how they themselves can benefit from breastfeeding. If they're trying to lose weight or get their bodies back into shape, and also that their babies are just much more healthier.
Could you speak a bit about when there's a delay or when you're noticing that there are issues that may be going on with a child that you have just done an assessment on?
Well, one of the good things about the assessments, we can do them fairly often. So when we do notice a delay in a child, we may send out for a referral for early intervention services, or we may have the family talk to the doctor to get more information. I have a family in particular where the mom was concerned that her daughter wasn't speaking, whether it wasn't enough or she just wasn't speaking at all. And that was one case where she's been working with early intervention services for probably about a year now, and we're noticing great changes in her. She's speaking a lot more, interacting a lot more, more subtly, where you may not need to often involve early intervention services. Could be an example just where, an infant isn't pushing up or sitting up or holding the head straight. And often we would just talk about developmental activities with the family, which could be tummy time, giving the baby more time on the floor just to develop the gross motor and fine motor development with the child.
Well, when we're doing an ASQ assessment with a child and we're noticing that the child is having some difficulties in a particular area, we work with the parent on giving them different activities to help build their child's developmental skills around in that area. And usually we are, constantly reassessing, and most of the children are able to succumb and overcome those developmental delays.
So most of the families we are working with in the Healthy Families program are teens, and they live in the homes with sometimes their mom and grandmother, and there are always conflicts around maybe the parenting role.
Initially, when we're going into the home, we try to become just a support to the family. And so when we're working with a teen mom that has a caregiver who's a mom who has a grandmother or their mom working with the baby as well, we try to allow the parent who's the caregiver in the home to have I guess an open floor where they can express what they feel are the issues in the home and the issues with the baby and the new mom. And we try to just give a supportive ear to let the family talk about the issues. And usually when we do that, they tend to work out the issues themselves. And then we're able to have a better relationship with the new mom because we gain the support of the caregiver. And they know that we're really there to just support them as a family.
Even though the mother and the baby are the participants in the program, as a home visitor, when I come into the home, I often include the family. Even though I'm there to see the daughter, it's mom's house, so I have to include the family, but it's my belief that they are the experts in their lives. So my role would just be to keep the baby the focus and the health and development of the baby. So, there may be conflict, but at the end of the day, we have to focus on what's best for the baby.
Could you expand a bit and talk more about the relationship building piece?
Well, I think it's probably one of the most important things that I do is build a relationship with them, because ultimately I want them to let me in their home so that I can share the information that I have. And again, it goes back to meeting the participant where they are and coming from a strength-based perspective. Most of them have been through so many things, and they don't have a person who, may tell them, I'm proud of you, you're doing a great job. And that's something that I make sure to do with them, is point out their strengths and the things that they've accomplished.
I think what builds the relationship with the home visitor and the participant is the fact that we see them on a weekly basis. And we really start out with helping them to develop some sort of goal for themselves and their babies. And we look for the positive things that they achieve out of the goals. And we just give them, the accolades that they deserve, because they're doing a good job in terms of the parenting.
And you build, it's like a sense of structure in their life, where as someone who may have experienced a lot of chaos, you bring some consistency into their lives.
Could you talk to us about participants that you have worked with that you really feel have benefited from the program, and share with us, that story?
Well, I have a participant that came into the program, and she was pregnant, and she came in and started receiving prenatal services of home visiting, and also attending the groups. She was very depressed, really would not look at you and have any eye contact, always looked down when she was talking, and really scored high on depression screenings on a regular. And throughout the pregnancy, she lost her baby at 6 months during the pregnancy. After, the devastation of that, she was referred to some grief counseling and some other services. And then she stopped participating in our program because she had lost the baby. Within the next year, she returned back to our program, and because she was expecting another child. She was still having some depression, but it wasn't as bad. And I would say that she became very involved, has been involved in a home visit on a regular basis. She has a doula through the Family Focused Inglewood program as well. She's attending the prenatal classes, and right now, her depression has like it's almost non-existent now. She looks at everyone when they're talking to her. She's able to have a very good conversation. She was having some grief issues where she was really afraid to carry this baby because she was afraid of losing, this baby. But she's shown like tremendous growth because of, I believe, the support that she's received on all of the different capacities of the programs that she's involved in Family Focus. And she's happier, she's reading to the baby. That was a challenge. At first, she wouldn't read to the baby because she was so afraid. Now she reads to the baby regularly, and she's, 8 months and just about ready to almost have the baby. And it's been really exciting to see her change and go from one level of, being really sad, and not really knowing what to expect to now being really kind of excited. So that is a very good, it was a really good success for me to see it.
Well, I have a family. It's probably one of my most difficult families. In the beginning, I didn't know how I could possibly help her. But I can say that through the work she's done with Family Focus, she's definitely thriving. She started off as a doula participant, so she did have a doula, and she worked through that. She's even receiving some of our counseling services through Chicago Safe Start. She experienced a lot of trauma, sexual abuse, physical abuse from her parents, her mother abused alcohol, just a lot of things which would trickle down to her relationship with her children. She didn't know how to be very affectionate. And I can remember hearing this participant say, Family Focus has saved my life. I don't know what I would have done without the help that I received from Family Focus. She's still receiving the counseling services. And I can happily say that next year, in September, she will successfully complete our program. Her child is in school. She's completed high school. She's in college. She has her own apartment. She's doing great.
How do you include dads in the home visiting program?
We have a father's program, a father's group, where the dads come together and they meet separately from the moms and talk about dad stuff. We also like to include the fathers in the home visits to get them and keep them involved with the development of the child and just their relationship with mom and baby.
When we do have the field trips, we try and engage family involvement. We tell them that they are able to bring the dads along with the babies so that they are able to engage in outings in the community or wherever as a family, and then it helps the father to get to know the home visitor as well as to get involved with the Family Focus Inglewood Center. They start to have, I guess, a desire to maybe try and see what the groups are like.
A home visitor primary role is to visit families within their home, to focus on the babies, and also to help to break cycles in terms of child abuse and ensure that the family is able to access as much resources as possible to engage and to enhance maybe the family structure as well as to enhance their ability to sustain the family as a whole.